I'm Dr. Nidhi Bansal Gupta from Nidhi Maternity and Gynae Clinic. I'm a consultant gynecologist, infertility specialist, and a laparoscopic surgeon. Previously, I shared my video discussing about the causes of bleeding in the first trimester of pregnancy. Today, let us discuss about the causes of bleeding in second and third trimester of bleeding. It can be divided into bleeding that occurs before 20 weeks of pregnancy, that is early in pregnancy, or which occurs after 20 weeks of pregnancy, that is late in pregnancy. The most common cause of bleeding in before 20 weeks of pregnancies are abortion or miscarriages. Whereas that occur after 20 weeks of pregnancy can be because of abruptio placenta, placenta previa. Then it can be because of labor, which can be premature labor or preterm labor, or it can be normal labor. Then other rare causes can be because of vasa previa or uterine rupture. Now let us discuss all these in detail. Now what is abruptio placenta? Abruptio placenta is a condition in which the placenta separates itself from the wall of uterus. It is seen in around 0.2 to 1% of pregnancy. It is generally seen in patients with hypertension or in advanced maternal ages. The patient will generally present with vaginal bleeding, severe abdominal pain, and uterine or abdominal tenderness. It is a serious condition. The patient should immediately report to the hospital. It can also result in fetal distress. Then the other cause is placenta previa. Placenta previa is a condition in which the placenta is not situated in the upper part of the uterus where it is normally situated, but is situated in the lower uterine segment that is very close to the os, which is the opening of the cervix. It either covers the os partially or completely. It is seen in around 0.2% of pregnancies. In placenta previa, the bleeding is generally causeless and painless and sudden in onset, and it is bright red in color. Whereas in abruptio placenta, it can be dark colored blood also. It is also a serious condition, and the patient should immediately report to the hospital in that case. Then it can be because of labor. If the labor starts before the baby matures, that is before the 37 weeks of pregnancy, then it is called as preterm labor. It might be associated with light bleeding, associated with discharge. And if the labor starts after 37 weeks of pregnancy, it is called as normal labor. And it is also associated with some amount of bleeding associated with discharge, which is called as show. Then other rare causes of bleeding can be because of uterine rupture or vasa previa, which are quite rare conditions. Uterine rupture occurs when the uterus ruptures or gives away at the line of scar, usually in patients with previous cesareans and during labor. Vasa previa is a rare condition in which the fetal vessels are located in the membranes covering the os of the uterus, which if ruptured can pose a threat to the baby. Other causes can be because of the inflammation of the cervix, cervical growth, or vaginal infection. So these are the main causes of bleeding in second and third trimester of pregnancy. Thank you. Keep waiting for more videos.